The philanthropist and billionaire founder of Microsoft, Bill Gates, has told Newsday that world leaders must urgently increase global health spending to prevent tens of millions more children suffering from malnutrition. The Gates Charitable Foundation is warning today that climate change will condemn an additional 40 million children to stunting between this year and 2050. Well, Mr. Gates told us that aid from rich nations isn't keeping pace with the scale of the challenges that many African countries face.
As we came into the world of global health, we saw that the data actually was a bit uncertain in terms of what kids were dying of and where kids were malnourished. And so a huge investment by the foundation has been creating a data system. And that's where this understanding that over 50% of these deaths, if the kid was not malnourished, they would have been able to survive. And the group that takes all this data and pulls it together, they started out where they were just gathering the data and looking at what happened. But then as they've gotten more sophisticated, they do forecasts now. And so they're able to look at what's going on with climate and what's going on with fertility and economic growth. And they're able to say that unless we intervene with better seeds, better approaches, that climate change will be responsible for a significant increase in malnutrition.
Philanthropist Bill Gates there. Well, one country that is making efforts to tackle malnourishment is Nigeria. The country's also been suffering from an economic crisis over the past year or so, and over the past week, devastating flooding in part. Well, we've put some of Bill Gates' concerns to Nigeria's Minister of Health and Social Welfare, Professor Muhammed Pate.
I think we have a problem with chronic malnutrition. We also have witnessed exacerbation, severe acute malnutrition and moderate malnutrition recently, just as several other countries in Africa, in the Sahel in particular. And due to a combination of reasons, endemic poverty in much of the region, high dependency in terms of the demographic structure, but also the impact of climate change, which is impacting food systems, impacting agricultural productivity. And I think we're seeing that manifest. I mean, just the flooding of farms. There are thousands and thousands of hectares of land of agricultural produce that have now been wasted because of flooding, which will exacerbate that. So in the case of Nigeria, I think we've been seeing this over time. And malnutrition contributes to at least half of child mortality.
That situation will have got worse over the past year or so when we've seen inflation, that the level of price rises in the country soaring, well over 30% generally, but I think 40% when it comes to food prices, meaning that people will have struggled even more than they did before the economic crisis to feed themselves.
Certainly, the increase in food prices across many countries, not only Nigeria, I think has affected the food security of households.
Although many people do say that some of the president's own economic policies have exacerbated the problem with the cost of living crisis.
Well, those adjustments, I think, certainly cannot be disconnected from this exacerbation of the problem of malnutrition. But mind you, malnutrition has been with us for decades, the chronic malnutrition, which is stunting, and then we're seeing severe acute malnutrition in particular this year, but also the previous several years. It's been present in parts of Nigeria. So it's a complex challenge, and certainly the macro fiscal situation and the rising prices of foods has contributed, but it's not the only driver of it. There are longer term trends that you will see.
Minister, can we talk about the flooding in Nigeria now? Maiduguri in particular has been badly affected by the flooding. 2 million people affected there. What is your assessment of how bad it is, and what resources are there to help people?
What's happening in many states in Nigeria, including Borno, has been unprecedented. Flooding that has affected several states. Some of those states are rural, but in Borno State and Maiduguri in particular, it's a very urbanized setting where there was a massive flooding that covered more than half this city that housed millions of people. I visited Maiduguri a few days ago and saw firsthand the tremendous displacement. It's affected millions of people, as you said, and hundreds of thousands of people were displaced, with water damaging the main hospital, the teaching hospital, which is one of the largest hospitals in Nigeria, flooding the cancer center, the pharmacy, destroying many other public infrastructure, but also homes of people and leading to loss of lives, unfortunately. And there was lots of suffering among, especially the most vulnerable women, children, lack of water, challenges with food. But at the same time, Borno State has been one that has suffered for many years from devastating terrorist incidences of Boko Haram. So it's built, I would say, some semblance of resilience that was beginning to show. The state government rallied, and the federal government, which I represented, alongside other leaders in the federal government, mobilized to support the state with basic things from identifying sources of chlorine to enable safe drinking water, to the medical relief side, medications for malaria, test kits for testing those who may be ill, begin to mobilize to find bed nets and other products and donations, in addition to medications for those who would be suffering from various ailments. The challenge in this situation is that contamination of water leads to all kinds of outbreaks, diarrheal diseases, gram-negative bacteria, cholera, but also exposure to mosquitoes in a warm environment will all continue to spread malaria, which could be a problem. So we have organized from the federal government to support the state through our various agencies, the Center for Disease Control, the Primary Healthcare Agency, to mobilize vaccines, to also provide emergency medical commodities alongside other UN agencies like WHO and UNICEF,
Right.
who joined me during the visit to Maiduguri.
So how confident are you then you can get ahead of any potential outbreak of waterborne diseases?
It's tough. There's the acute stage, which is we're trying to prevent those outbreaks from happening. I think there will be a spike. I think there will be diarrheal diseases because of the circumstances of sanitation in the context of contamination of water. But I think our hope is to numb it, to prevent it from occurring. And I think with the mobilization, we have a fair chance. It will take some time to know the full extent of the damage caused by the flooding. There are other aspects, the revival of the teaching hospital, for instance, to make it functional because life continues. Women are delivering. Some will require surgery. There are others who have other medical conditions who require care. So really trying to bring that back up so that Maiduguri will begin to head towards normalcy, which will take time given the extent of the damage that has been experienced. I think it will take months after the water has receded for normalcy to be restored. Hopefully, for those who have been displaced, to go back to their homes. And also, if you know Maiduguri, it's a very large city, people from all over, and hundreds of thousands of people now are out of their homes. They haven't even gone back to see what is left of their furniture, of their homes, lost loved ones. So it will take months, at least. That's my sense.
Professor Muhammed Ali Pate there, Nigeria's Minister of Health and Social Welfare.